With headlines that read, the FDA may limit future COVID shots and only be giving them to older people and those at serious risk of infection, you may feel as if our National Health Initiative is in fact limiting preventative measures for underserved communities. To better understand what is happening with preventative health care in this country, as well as people's understanding of vaccines and how they work, we invited Dr. Peter Hotez to the program. Hotez is a pediatrician, scientist, author, and advocate in the field of global health, vaccinology, and tropical disease control. A busy man, he also holds the position of dean at the National School of Tropical Medicine at Baylor College of Medicine in Houston, Texas, in addition to co-director of the Texas Children's Hospital Center for Vaccine Development. Got all that out. Good morning, Dr. Hotez.
Glad you got it all in, Ernie. Sorry, we're out of time now.
Yeah, I know. I don't have time to talk to you. I guess the place to start is the announcement we saw yesterday from the FDA. I guess it's questioning who should be getting vaccinated and what they will support moving forward. Help us understand what they actually said and what it actually means at this point.
So one part makes sense to me. The other part's a bit of a head scratcher. So the part that makes sense to me is, based on case fatality rates and hospitalization rates, sort of the acute phase of COVID, they are recommending an annual update to be determined in terms of the exact composition, and we could talk about that for those over the age of 65, people like me, and those with underlying health conditions. And the list is provided. And they did it sort of out of the box, but kind of interesting. They did it as an editorial in the New England Journal of Medicine rather than as a FDA guidance document. But fine. I mean, that part makes all that is okay. The part that I disagreed with was that they appeared not to consider other long-term consequences. And what do I mean by that? Well, what they did was they are now not allowing people under the age of 65 to get vaccinated unless you have underlying.
Are they not allowing them, or are they not paying for it?
They're not. It sounds to me the document, and I guess the pharmacies will agree with it. Interestingly, they bypassed the CDC for it. So usually the FDA will sign off on a product and say it's safe and effective, but then it's up to the Advisory Committee on Immunization Practices of the CDC to then detail how it's actually going to be used. They jumped over all of that and basically provided that guidance. And what they said was, we're not going to make this vaccine available for those under the age of 65 unless the drug companies repeat all of the clinical trials all over again for this updated variant, which is too expensive, right? I mean, and it would be a massive study because by now so many people have been either naturally infected or vaccinated or both, some combination of it. It would be a massive study and prohibitively expensive. So And I'll tell you the concerns I have about not making it available for those under the age of 65.
My initial reaction, though, is that you want to protect your older population. One way to protect them is you vaccinate the full community because then there's less spread of the illness, the disease. Therefore, that also protects the people of older age. If you're only giving it to the over 65 and those at high risk, you do run a risk of COVID running rampant and then coming back toward that same group you're trying to protect.
So we're in Vulcan mind meld mode.
Okay,
we totally agree. So the first thing I got were all these direct messages I got some direct messages and emails saying, "Hey doc, I'm 40 to 50 years old. I'm not going to be eligible now, and I'm worried about passing the virus on to my aging parents."
Well, that's what I was going to ask you, Dr. Hotez. So does that mean, I understand there's going to be a vaccine, a new one coming out in September. If my husband and I, we are within the 30 to 40 age group, want to go to our local Walmart like we have before, can we still do that?
Not
Walmart, Walgreens.
Not unless you make the case that you've got one of the risk factors, and it's a pretty big laundry list of risk factors that's in the New England Journal of Medicine paper. And we'll talk about a couple of those in a minute. But the other concern I have, other than transmitting the virus to, because these vaccines do contrary to what you hear from the anti-vaccine activists, there is reduction in virus transmission if you're vaccinated, because the level of virus neutralizing antibody is so high that it gets into the nose and throat washings and it limits virus excretion. It does do that. Not as well as we'd like, but it does do that.
So it helps you, and it helps you not to pass it on.
It helps your community.
That's right. That's
really
right.
quickly, I want to remind folks the phone number here if you want to call and ask questions, 713-440-8870 to talk to Dr. Hotez. Continue.
But the other reason that, one of the reasons I'm so eager to get the annual immunization when it's made available is because if you keep up with your annual immunizations and boosters, you're less likely to get long COVID. Neurologic sequelae, heart sequelae. This is a thromboembolic virus.
What do we know now about long COVID? I remember all through the early years when we would talk all the time about this, we were still finding out more and more. It's been a good clip of time now. What is long COVID and what do we know about
long
it?
COVID is prolonged symptoms, and there's a whole list of criteria in terms of neurologic complications, heart complications, respiratory and neuromuscular complications. And the underlying reasons for it are still controversial. For instance, there's a controversy whether it's due to persistence of the virus in the body or whether it's due to an overreaction of the immune system to the virus, and whether you're getting especially autoimmune responses in the brain. But the point is there's now really good data to show that if you keep up with your vaccinations, you're less likely to get long COVID, even in kids. And there was a study recently published from the University of Pennsylvania.
If you get COVID and you don't get sick, but you've been infected and you get through it relatively quickly, are you still at risk of long COVID?
If you're not vaccinated, you're at higher risk.
So
I want to ask a quick question. So there was all this talk about a combination flu COVID vaccine where you would just get one shot and they would be combined. Has that been abandoned? That idea?
That's still on the table. I know Moderna is pursuing a combo flu and COVID vaccine. I don't know exactly what the status is at this point, but we'll see if that gets on the table.
Well, it's so hard
as well.
for people to get the flu vaccine, and that kills a lot of people.
Absolutely,
as you know, it's hard to get
the
people,
flu, not the vaccine.
The flu, but the flu. But getting them to the table to get the flu vaccine was hard enough. Getting them to get, and now I just think it's going to be more difficult if you say, well, but you can come for the flu, but you don't get the COVID. Sorry.
Yeah, and then there's a third piece that sort of gets me a little bit upset. This regime, this new Department of Health and Human Services, they're always flying this banner of health freedom, medical freedom. Mm-hmm. We're not going to insert the government into your life, this libertarian philosophy. And okay, I mean, there may be parts I agree and don't agree with, but, now they've basically taken your decision whether or not you want to get vaccinated. Well, it was a decision between you and your healthcare provider and physician, and they've put it in the hands of the government. It's so hypocritical, right? I mean,
agreed.
Dr. Hotez, I do want to go back to long COVID because last year I got COVID 3 or 4 times, and every single time it got worse. I'm a runner. I'm very healthy. Now, I'm also going to just put myself out there. I did receive the original first vaccines. But as somebody who I am on Instagram, I'm on my phone, I started to get really scared about vaccines because there is a group of people within my age that have young children, and it is a real concern that my concern was I'm getting COVID often. I took Paxlovid the 3rd time. And then a few weeks later, I got it again, and it was COVID was really bad on me.
That's a common experience, by the way. So if you get repeated bouts of COVID, I mean, anybody can get long COVID after a case of COVID. It's more likely if you've had repeated bouts of COVID or if you've had a severe case of COVID.
So
that's the reason.
Should I be getting the vaccine even though I've had it multiple times?
Yeah. Now, I guess one question is, after you had your first 2 immunizations way back in 2021, did you get boosters regularly?
I got 1 booster, and then after that, I stopped getting them.
Yeah, so that's the reason why you keep up with the booster. I mean, the disappointment with the mRNA vaccine. I mean, by the way, we made a different vaccine, a low-cost recombinant protein vaccine for India and Indonesia. every vaccine has advantages and disadvantages. The nice thing about mRNA is it's quick to make, and you can move vaccinate populations quickly. The one disadvantage of the mRNA technology, in my view, is its durability, so that you wind up having to get vaccinated every 6 months, which is a real pain.
Well, it's funny because now I'm worried that I'm not going to be able to because now I'm petrified of long COVID. I am absolutely petrified of it. I have been.
In my view, you should get the immunization. Now, the good news in this,
Give me some
if
good
you
news.
look at the list,
Please.
if you look at that list that they put out in the New England Journal of Medicine,
We can all find
it's a
something in
really
there.
long list.
We're all on it.
And it even says, something like low physical activity. So
I'm in.
So so I don't know. I certainly don't want to give advice on how to skirt the rules, but it seems to me that if you're on Sunday afternoon, if you want to watch both the Cowboys and the Texans, that's a long afternoon of not.
Would Celeste qualify simply because she's had 3 cases of COVID in 1 year?
I don't know if that would be a criterion.
Why wouldn't it be?
I mean, it's certainly if you're immunocompromised. I mean,
It sounds like she is.
Well, that would be a decision she makes between
As
your
we
physical.
learn
I'm
more.
going to take Frank to the pharmacy.
The other confusing aspect is who makes the decision whether you're on that list of criteria.
Well, that's what I was going to ask.
Is it self-reporting and you tell your pharmacist, or does it require a
Can
letter
a doctor
from
say,
the physician?
I believe my patient qualifies for this vaccine,
Certainly,
and that's all
if
they
your
need?
doctor's willing to do. The question is that, but all of these things are barriers to access, and
Right.
and,
Well,
you know,
I have
that's-
prostate cancer.
I'm a big believer in making it easy breezy.
I've always gotten it early because of my previous history with prostate cancer. But the pharmacies never said prove it.
Right.
Prove to me that
That's
you
right.
have prostate cancer.
So one of the unknowns after this guidance document is who makes the decision now on whether you
We are
qualify.
talking with Dr. Peter Hotez, taking your questions, comments, thoughts. You can email us at talk@hellohouston.org, or you can call us and text us, 713-440-8870. We got an email comment in from Bob. Bob says, Peter, you're a gift to Houston. Your calm, experienced voice speaking truth to conspiracy theories is powerful and necessary. We should all thank you for your courage in the face of a tsunami of disinformation. Keep up the great work.
Oh, that made my day. Thank you so much.
We have a call.
I'm going to print it out and send it to all my bosses.
I know, right? Your Christmas
Remind
card.
people. Yeah.
Yes, and we have a call from Carol from Montrose. Carol, what is your question or comment for Dr. Hotez?
Well, I do agree that Dr. Hotez is a gift to Houston and to our country. And I have taken Pfizer boosters regularly. And a few weeks ago, since I'd gotten one of those, you are of a certain age and you should get another booster, after I went and had a COVID test because I'd been around so many people, and it was negative, I went ahead and had the booster. I will tell you, it was the worst experience I've ever had.
When you say worst experience, what do you mean?
Well, I'm going to go through my symptoms.
Okay,
Yeah.
bring
It's
them to
it's
us
a
quickly.
30-minute show here.
Yeah. We won't go through that because I wrote them down so I could tell you. And really bad cough with deep phlegm. I was sleepy. I was sleeping 16 hours a day. I was so tired.
Now, when did you
And
have
then-
your COVID?
I've never had COVID.
The doctor couldn't hear you the beginning of your question. Let me just recap it. That she got the Pfizer booster a few weeks ago. She thought she may have had COVID. She took a test. She was negative, so she ended up getting a booster.
And then had
And then how long after you got the booster did you have your symptoms?
2 days.
So
2 days after that.
Now one possibility, unfortunately, is it can take a couple of weeks for the booster to kick in. So what possibly could have happened is in between the time you got the booster and the immune response kicks in, you could have gotten some intercurrent viral infection, such as COVID or flu or a gazillion other things. So sometimes it's hard to know what's ascribed to a side effect of the vaccine versus some other intercurrent illness.
And let's talk about that. I want to thank you, Carol, for your call, but let's talk about those side effects. A lot of people believe if you get vaccinated, you can get it. They talk about this with the flu. I got the flu vaccine, but then I got the flu. It gave it to me. Explain the logic behind that or lack thereof.
Well, the flu vaccine, because it's not always a perfect match between, because it's a bit of an art to predict what's going to be the circulating flu strain that year. So it could be that there's an imperfect match. So on average, the flu vaccine protects about 40%.
But the vaccine cannot give you the illness.
The vaccine will not give you the illness.
Same thing with COVID vaccine.
That's right.
Can I touch on the shingles vaccine? I know we have a call holding, because I got the shingles vaccine. In fact, I got the early one. I got the next ones too. Well, they're the one thing that really kicked my butt.
Yeah,
I mean,
me too.
Why
Me
is
too.
that? Why
yeah,
is that?
because it's the Shingrix vaccine from GlaxoSmithKline. It's a recombinant protein vaccine, and we make recombinant protein vaccines. And you need powerful immunostimulants, adjuvants, to really get a strong antibody response to those recombinant proteins. And the GSK's vaccine system is called AS01, and it's got lots of toll-like receptor agonists, and it really does a job.
I was exhausted.
Some people are fine with it.
Really?
With me, it gave me a pretty.
Well, you should
pretty
still
better.
get it if you're over 50.
But you don't want to get shingles. And by the way, there's a new finding which is a puzzler, but it's exciting. Shingrix. If you get Shingrix, you're less likely to get Alzheimer's.
I saw that.
Wow.
I'm going to get some right now.
But
mean-
and so it's really interesting. The question is, what's the mechanism there?
I know, right?
Right.
Does the varicella zoster virus have a role in Alzheimer's? Is there what's the mechanism?
Our number here is 713-440-8870. Jerry is on the line from Midtown. Jerry, what's your question?
Hi, good morning, all. I do have a question for the doctor, just sort of on the general nature of disease in general. I mean, I think, until a few years ago, until COVID, really, all diseases seem to be defined by their symptoms, right? I mean, if you had the flu, you identified the flu because there were recognizable symptoms, right? The chickenpox has recognizable symptoms. All kinds of different diseases have. This is how we know what a disease is, or at least this is how we used to know what a disease is. With COVID, maybe you don't have any symptoms. Some people lose their sense of smell and some people don't. Some people seem to, it just seems to be all over the map. And I'd like to know is there any other disease with this, inconsistency of symptoms?
Yeah, no, it's actually a very profound point, because this is what made COVID so problematic. So, for instance, there was a related virus. So the other name for COVID is SARS-2, Severe Acute Respiratory Syndrome 2, SARS-2. The original SARS-1, emerged also out of China by the same mechanism in zoonotic spillover in 2002. That one, if you got it, you were really, really sick. And as a consequence, you were either going home or into the hospital, because it had a very high case fatality rate. And for that reason, if you had SARS-1, you weren't going to bars and restaurants and music concerts. That's why the epidemic didn't propagate. The problem with SARS-2 is that for everyone who was very sick, you had someone that was largely without symptoms, and they were going off to bars and concerts and spreading the virus around. And that's what made contact tracing just about impossible, and why this thing spread across the world as it did. That simple observation. And, different viruses have different obvious or less obvious presentation. Let me give you another example that's going to be relevant this summer. At the School of Tropical Medicine, we're watching the rise of all these mosquito-transmitted virus infections. Not only West Nile, but we're worried about dengue and chikungunya and Zika and maybe even
I have a
potentially
whole list to ask you
yellow
about.
fever and
Malaria.
and guess what? They all present with fever, headache, and rash, and what's called photophobia. So we're now actually we're doing this really cool project. We got supported by the Lyda Hill Foundation to actually create a climate health, because these are happening because of climate change and urbanization, a climate health early warning system where we know ahead of time what's in the mosquitoes, so that we can inform the ER physicians and let them know what's already out there, So, because otherwise you wait 2 weeks to send a specialty test off to our lab.
Quick point, just so people understand. People are still dying from COVID in this country. It is still a serious thing. We seem to take it as a nuisance. You get sick with it, or the problems with long COVID, but there are still fatalities at a good number.
Absolutely, and this is why it's I'm concerned about not making the vaccine available to anyone who
But
wants.
wouldn't you say, though, sorry, Dr. Hotez, but wouldn't you say there's still people that are dying of the flu? And the flu has been around for a long time, and we've had vaccines around the flu.
Yeah, but not enough people take vaccines. So we've had about 12,000 flu deaths so far, and we're still, and that's early in the epidemic accounting, so it could be double. So it's going to be a bad flu season.
So, all right, this rule comes along. Nobody under 65 can take this COVID vaccine. And
unless you have the risk factors.
Unless you have the risk factor. And then, but let's say that this is a dumb idea, and all these people in their 30s, early 30s, and 40s and 50s get COVID and start spreading it among each other, and then to seniors that didn't get vaccinated for whatever reason. And we end up with this huge COVID epidemic again. Is that possible? And how long, if they say, okay, we were wrong, let's go back to vaccines, how long would it take to recover from that?
Yeah, that's why, don't mess with a good thing,
Right.
And by the way, even if they make it available to everyone, unfortunately, with all of the anti-vaccine disinformation out there, only about 25% of eligible Americans take it anyway. So, which is really unfortunate.
We have another call coming in at 713-440-8870. James from Westheimer. What's on your mind, James?
Hi, Ernie, and hi, Frank. And I apologize. What's the other co-host's name?
Celeste. She won't let you forget it.
It's my name. Don't wear it out.
Celeste. Okay. So I have a question for the doctor. Dr. Hotez, I am a 22-year-old male. The last time I remember having COVID, now that doesn't mean I didn't have it since then, but the last time I remember having COVID was around this time of year, summer, June, July of 2023. And I am not the healthiest for my age. I certainly fall under that category, physical inactivity, as published by the New England Journal of Medicine. But my question is, I like to visit with my elderly family often. Mm-hmm. And my question to you is, based off my current little synopsis of my health, age, gender, stuff like that. Should I get the medicine now before it becomes harder to, or do you think it's not worthwhile for a person of my age?
I would say, given the fact that you're visiting elderly parents and you qualify because of a risk factor, go ahead and get the annual immunization when it's available this fall. I think the other question, though, is when did you last get your last immunization, and should you get something sooner? But definitely when it's available this fall, I would definitely do it.
Going back to the phone, I'll grab you in 1 minute, Celeste. I want to get to Rico from League City. What's your question for the doctor?
Within your general knowledge, now that they've edicted, COVID is not required for a certain age group, do you foresee this happening across all vaccines? Now, the flu vaccine is only going to be available for certain groups, and the MMR vaccine is only going to be available for certain groups. Or within your wheelhouse, do you foresee that coming down?
What's the trend?
Yeah, well, the trends are not great when you've got Robert F. Kennedy Jr. as Health and Human Services Secretary, when he is probably the best known anti-vaccine activist, and he's downplaying the severity of measles and makes things up. Like he says, the 90 hospitalizations that we've had with kids in Texas is due to quarantine and isolation. And he says things like the MMR vaccine, the measles, mumps, rubella vaccine, is contaminated with aborted fetal material, or it's a leaky vaccine. I mean, every few days he comes out with a zinger. And, and I was complaining to my wife, Ann. I said, I was kind of hoping to get a break from all this media with COVID sort of winding down, and Mr. Kennedy seems determined to take me out of retirement and just keeps up with this crazy stuff.
I get the feeling people are going to have to die unnecessarily for people like Kennedy to say I was wrong.
Well, we've already had 2 measles deaths in Texas among 2 kids.
There you go.
School-age kids are completely healthy, and parents made the executive decision not to vaccinate them based on being flooded with disinformation.
Dr. Hotez, we do have a question from Megan in the Woodlands. She says, can Dr. Hotez clarify herd immunity?
So for the best example of herd immunity is for measles. So if a high enough percentage of people get immunized, and eventually that kind of stops the virus from propagating in the community because the MMR vaccine is that good. The problem is the bar is pretty high. It requires 95% vaccine coverage in order to get that. And different pathogens have different set levels where herd immunity occurs, and you can actually do a calculation based on what's called the reproductive number of the infectious
What's
agent.
COVID's? How many of us need the COVID vaccine to create herd immunity?
Well, here is the problem with herd immunity with COVID is that the herd immunity assumes that there's no antigenic variation or shift in the pathogen, and that was the problem with COVID. So we never really got to true herd immunity because of COVID, because of all of the
a lot of people make that argument. Well, herd immunity.
Well, Dr. Hotez, I have a question. When it comes to COVID, people like myself that got it multiple times, I hear oftentimes people are like, well, your antibodies, where were your antibodies? Once you get it, your body has antibodies for 3 to 6 months. How does that work with people that continue to get it?
See, the problem, it's a particular problem with the newer variants. So if you remember, with the original lineage and the alpha variant, that virus was replicating deep in the tissues and a very, of course, high case fatality rate. But the level of protective immunity from infection was pretty high. The problem with these newer variants, what are sometimes called Omicron variants, they tend to replicate more in the upper airways, and the level of natural immunity is not nearly as high. So infection with one of these newer variants really doesn't give you much protection. That's why you're getting, just like when you can get, colds all the time. It's the same kind of thing.
We were talking about herd immunity. We've talked about getting vaccinated. We've talked about and I don't know if in this conversation we have, but we're a global society now. With the cutting of funding to USAID, how does that impact not just COVID, but other illnesses that you see emerging around the globe?
Well, and unfortunately, 3 things are happening at once. They're gutting USAID, they're pulling out of support for the World Health Organization and the Gavi Alliance, Global Alliance of Vaccines and Immunization, and they're slashing budgets from the National Institutes of Health. And by the way, they're deliberately targeting the National Institutes of Allergy and Infectious Diseases of the NIH. So if you look at the cuts so far, Bernie Sanders came out with a report last week, $500 million cuts already to the National Institutes of Allergy and Infectious Diseases. The next one down was like $60 million to mental health and heart, lung, and blood. So they're basically decimating our ability to do surveillance for infectious diseases.
Well, to that point,
so what it means is our reduced ability to develop countermeasures such as new antiviral drugs and vaccines and diagnostics, and less ability to do surveillance for these illnesses that continually arise, and not having a seat at the table where global health decisions are being made in Geneva at the World Health Organization. So it weakens our biosecurity.
Do you think we'll ever have a vaccine for HIV?
There's a lot of exciting work. I mean, it's like what Churchill said about a certain country. It has great potential and it always will. But I do think, yes, we eventually could get there, but currently not with the budgets being slashed that we're seeing, though.
When we talk about what you were just talking about a moment ago with what's going on with funding and globally, are we going to see a resurgence, as we already have in some cases, of more of these things we thought were no longer a problem? Are we going to see us slipping back in what people are going to be getting infected with, the abilities to deal with it, the herd immunities going down? What is your prognosis
Yeah,
for the future.
my worry over the last 20 years, we've seen, one of the most common questions I'm asked is, "Hey doc, what the heck is going on?" That's actually the question.
That's what I want to know.
And
my question is like, are we going to be okay?
And so, what do you really mean by that? What the heck is going on? And the answer, and when you ask them, what they really mean is, why did we see SARS in 2002? Why did we see H1N1 in 2009? Ebola in 2014 that hit Dallas. That's when I went on Governor Rick Perry's task force and stayed on it with Governor Abbott. Then why did we get Zika in 2016? Then in 2019, Ebola again. Then COVID-19. Now we've got this thing called H5N1. And by the way, we're going to have a fourth major coronavirus, I predict, based on that regular cadence. And I give a whole lecture on this, and there's two big forces that are driving it. Shifting climate patterns, because a lot of these are viruses of bats, and as well as the mosquito-transmitted viruses, and urbanization.
Wow. Dr. Peter Hotez is a pediatrician, scientist, author, and advocate in the fields of global health, vaccinology, and tropical disease control. Dr. Hotez, thank you for joining us today on Hello Houston.
Great to be here.
Thank you.